What's coming in London in April is going to be a watershed event. I think of all of the seminars I have taught, everything has been leading to this seminar called Classical Theory in Clinical Practice, Understanding Chinese Medicine Pathology and Physiology in Actual Patients. The evolution of the 9 essential needling techniques was I was teaching tangible acupuncture for internal medicine in London. And people would say, well, what are you doing with the needle? And I'd say, well, I'm doing this so that she does this, and I'm doing that. And they kept asking these questions that we formulated 9 basic techniques for them to differentiate what they were actually seeing. That has been spectacularly successful in the seminars we've been teaching since then. But people still are missing well, I can do the techniques, and now I'm realizing that I'm not seeing patients the way you do. So I'm not able to say so clearly, I need to be using this technique to this degree on this patient, or I need to do first cooling sky and then channel traveling, or first channel traveling and then burning mountain. I need to first raise the chi up to the head or down to the feet, or gather it before I do a different technique. This lack of understanding of how I see patients is what is missing. And that is what London is going to solve. For the first time ever, I'm going to be completely focused, 3 solid days of teaching on this is it. Patients, yin, yang, qi, blood, their pulse, their tongue. This is what it means in the clinic when they have an illness. This is what I expect to see. This is why I choose techniques or don't choose these techniques, or use these herbs and don't use these herbs, based on their qi and blood, on their yin and yang. That now, for the first time in 2020, we're going to put all of that material into a very clear format so that those of you who have been training for a long time, or those of you who have been training in classical Chinese medicine but have having trouble getting from classical theory into patients and getting the results that the books talk about. And that's because the books have a view of live patients that we can't see through the pages. For me, in the clinic, year after year, day after day, all of those years with each of my teachers, they would say, this is it in real life. Here is this pulse. And you see this? In this situation, it means they're getting better. In this situation, it means they're getting worse. See this patient? If you give them cold, bitter herbs, their heat's going to get worse, 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 worse. If you give them warm, sweet herbs or warm, acrid herbs, this will happen. Do you see how this is different? Don't forget to notice this. There was this constant putting the classics into live human bodies as my time was spent with them, seeing them treat patients. And so London 2020, Classical Theory and Clinical Practice, Understanding Chinese Medicine Pathology and Physiology in Actual Patients, is going to be the watershed seminar. This is perhaps the most important link between classical theory and clinical practice, finally presented in a clear format. So I hope you'll be there for that.